Welcome back, everybody, to My Last Brain Cell. Happy Friday, Junior. This month, I'm not gonna lie to you guys, it's low-key dragging. We still have another damn near full week of October. Isn't that something to think about? To me, it's crazy. But anyway, y'all, happy Friday, Junior. You feel me? We're back with another episode, and honestly, the last episode of the Medical Mysteries game. Yesterday, our patient, unfortunately, while she survived the night, because I'm not a real doctor and didn't read enough, she ended up dying a week later. So that was heartbreaking. So with that said, we are gonna make sure that when it comes to the treatment and everything that these patients have, we're gonna run through the entire list just to make sure we don't, run into the same problem we had last time. Before we get started, just some housekeeping things. You may have noticed that the last couple of days you have not gotten short, spooky stories, and it's because I'm kind of overworking. Let me explain. Like, work has been crazy itself. Obviously, I don't get paid for creating content. You feel me? So I still work a regular 9 to 5. But my 9 to 5 is more like a 6 to 5 sometimes, or a 6 to 6, or whatever it may be. So I'd be tired. I gotta go to the gym and other things. Like, I have a life to live. So with that said, what I decided to do was, as you saw, because this is an episode week anyway, right? Like, this is a week you guys get normal episodes from me. I decided, why not just give you guys clips of those episodes? Duh, it just makes sense. And then next week, you'll go back to getting short story, like short spooky stories. You feel me? We'll go back to getting those. So yeah, I just wanted to kind of cover that with you guys and kind of go over why it's been like, yo, what is short stories at? Yo, I thought we were getting, you are next week again. And with next week being Halloween, I do have something really special in store for you guys. So be on the lookout for that. But anyway, let's get into this. Our last patient, patient 4, Pete Johnson. It says paramedics bring in the 4th patient who is strapped to a stretcher. He is obviously drunk and can't stop cursing. This guy is going to be a challenge. Good luck. That's exciting for me. I'm looking forward to it. Don't look at the epilogue. Immediately put that away. Make sure nothing is on it that I need. Nope. All right. We got his EMR. Okay, I was like, something's missing. We got his patient form, and we got his intake interview as well. And so I'm pretty sure we're gonna start with status card 1, but I won't pull it out just yet. Even though, yeah, you know what? Let's stop playing around. Let's go ahead and pull out status card 1 because we know that's what we're gonna start with. I see everything that we have, but we'll go through it as we need to. Let's read the EMR first before we read his intake interview, right? So his face has cuts and bruises. He's altered, slurred words, and his left forearm has a laceration. No recent illness, allergies, travel, or medication. Temperature is normal. Heart rate is normal. Blood pressure is a little higher. Actually, the blood pressure looks normal. Nope. Past medical history, hypertension, but he has not taken his blood pressure medication. His last visit was 3 years ago. Family history is unknown. He was adopted under a closed adoption with no family medical history available. So that's not good. We don't know what is in his history or what could potentially be, some things to look out for. Social history: he's divorced with 3 kids. He lives with who live with the mom. During a prior visit, he stated he smokes 5 to 10 cigarettes weekly. So his lungs are probably beat to shit, and his liver is also not happy. And he drinks 2 to 3 drinks on weekends. Previously referred to stress management program. Oh, he's not an alcoholic. He's just a smoker. So cuts and bruises brought by paramedics because of a large laceration on his left forearm. He's agitated and non-cooperative. Respiratory, he won't let us check. He's non-cooperative. His head, ears, eyes, nose, and throat. Pale appearance of the facial skin. Redness on nose. Neurological. Altered cognition in his slurring words. He's not cooperative, so I can't get his cardiovascular, his muscular skeletal, or his abdomen. Extremities, laceration on left forearm. Skin, cuts, and bruises. And again, I can't check anything else. Paramedic reports. Witnesses say he has a long laceration on his left arm that he got during the fight. The bar owner wrapped the laceration with a bar towel. Patient would not let us touch his arm. However, the bleeding appears to be under control. He may have lost a lot of blood at the scene. Police officer reports. We questioned the bartender and other witnesses. They said that he appeared, intoxicated when he arrived and had another 2 drinks before someone provoked him by accusing him of crashing his bike into their motorcycle parked in front of the bar. A fight ensued. The scene was chaotic with broken glass everywhere. And actually, so in his last physical exam, his blood pressure was 130/80, and right now it's 109/71. So I'm pretty sure that's normal, or within normal range, right? I don't know. Intake interview. Pete Johnson is a train wreck. He's got bruises on his face. His arm is wrapped in cloth soaked completely through with blood. He's also strapped down to the stretcher and yelling incoherently. The stench of alcohol is impossible to miss. "You've got a live one here," said the paramedic, wheeling him in. "He tried to jump out the back of the ambulance, so we restrained him. He hasn't let us do much. We haven't even been able to dress his wounds." Pete strains against the wrist straps. "Let me go," he demands. Nurse Judy talks soothingly to him to calm him down while he listens to the paramedic. "We got called in after our buddy here got thrown through the bar window in a fight, landed on the sidewalk and didn't get up. But get this, before the fight, he was telling everyone about how he'd just been in a motorcycle accident. Instead of getting himself checked out at the hospital, he drove to the bar. The owner told me he thought Pete may have already been drinking before he arrived. Well, he's yours now. Good luck with him." As you approach the stretcher, you hear Pete tell Nurse Judy, "I just need Rachel." She says something quietly and he stops struggling, his energy spent. You look him over. There's a lot of blood on his clothing and skin. It's unclear how much the blood has been diluted with other liquids like water or alcohol. You step forward to examine his arm. You realize it's wrapped in what used to be a white bar towel. "Don't touch me," slurs Pete. "I'm all right. I'm okay." And it does say all right. I need you guys to know that. Pete's face is pale and distraught. He closes his eyes and mumbles something to himself. Before you release Pete from the stretcher, you call security to be nearby in case there's a problem. But you're fairly confident Pete won't be much trouble. His struggles against the straps were weak, as if he'd worn himself out. And who knows how much blood he's lost. "Pete," you say. "I'm Dr. James, by the way." "Rachel?" He interrupts. "I want to talk to Rachel. It looks like it's going to be a challenging night. Take story card 1 and take status card 1, drunk and non-cooperative." Okay. So, like always, I spend one action per 2 questions, and it just so happens that there's only 4 questions. So that makes life very, very easy. The 4 questions: what happened to you? How much did you drink? Did you take anything else? Which are the same question: how much did you drink to take anything else? Where do you hurt? And tell me about Rachel. And let's start with tell me about Rachel. Tell me about Rachel is SMA. And then we'll get to, once I get all the questions, we'll get to what's happening over here. SMA. Because I'm also nervous about his blood pressure. That's something that I've been thinking about because he doesn't take medication for it, but it seems to be kind of under control. So I am curious to know what he's doing. And that's if that's under control. 109/71. I have no idea. Okay. Pete's head sags as you ask your question. Then he looks up, his eyes crossing. He mumbles something unintelligible. You ask your question again. "Rachel. It's all because of Rachel." You ask how Rachel is involved. Pete closes his eyes and says, "She's the one I've low. I hurt so much." Then he starts crying and you can't get another word out of him. There's no point in asking Pete any more questions. No! Well, that's great. Oh, wait. Maybe that... Okay. Fuck. That sucks, doesn't it? We're still gonna see if, because I still have one more thing to do anyway. We're still gonna see what else we can ask him. Let's try how much did you drink and did you take anything else? FZF. Shit. It's all take story card 5. Damn it. Okay, so this is not going to be... Alright, so drink, question mark, FZF. Yeah, no more Qs. Alright, so I know what a physical exam is. The drug panel will be obvious, so we can do all those things. The thing I need to make sure I need to check up on are the drugs that are available. So the drugs that are currently available, and obviously there's not obviously, but there are also options here to dress his arm, give him sutures, bring out a crash cart, and also do a blood transfusion. And I assume the blood transfusion is gonna be necessary, as well as dressing his arm. But I don't know what I should do first between dressing his arm or give him the blood transfusion, which I assume I should have to dress his arm first and then give him the blood transfusion. But let's make sure I do all the right stuff. I want to see the drugs I could potentially be giving him. So acetaminophen, first line for moderate pain. I can't tell if he's in pain. Oh, combining with alcohol increase the risk of kidney damage, liver failure. We won't be giving him acetaminophen. IV fluids, which might be helpful given how much blood he's lost. Prevent or treat dehydration, used in people of all ages, low risk of complications. So we could possibly give him an IV. Ketamine, used as a pain medication. Dissociative properties, also made a popular choice for sedating highly agitated patients. Potentially fatal in alcohol intoxicated patients. So, nope, no ketamine. That's 2 things eliminated. Midazolam, used for conscious sedation, such as to calm an anxious patient before a test that requires patient to be still. Used in sedative emergencies. The use of cannabis and grapefruit juice along with alcohol can cause major reactions, including breathing problems. Won't be using that. Next, naproxen, used to relieve pain, tenderness, swelling, and stiffness. May cause ulcers, bleeding, or holes in the esophagus, stomach, or is safe to use alongside alcohol. So naproxen and IV fluids seem to be okay so far. I just need to make sure I watch for the bleeding. And Vicodin, which means we'll definitely need to get him before we give him the naproxen. We need to give him a blood transfusion because we have no idea how much blood he's lost. And then Vicodin, combination of hydrocodone and acetaminophen. So no acetaminophen. Yeah, no. So no Vicodin. So we can't give him IV fluids and we can't give him naproxen. I will probably have to get a psychiatrist, which is also an option on here. I don't know about the neurologist though. But first, I'm debating, if I should give him the physical first or dress his arm. I'm thinking I should just jump. I should do the physical first, then dress his arm. We gotta see what's going on here. FYF. Pardon me, by the way. I don't know if that picked up on the mic, but if it did, I should probably excuse myself. FYF. You ask Pete if you can examine him. He mumbles something you can't understand. You tell Pete you are going to touch him to see if he has other injuries. As you begin to examine him, he moans, Rachel. As you touch his stomach and then his side, his hand grabs your hand. Stop, he says. That hurts. And I'm a married man. Then he starts crying and won't let you continue the exam. Well, shit. Uncooperative. All right. I'm going to dress his arm. I don't want to call in the other doctors yet because I don't know if he'll even talk to them anyway. You know what I mean? So we'll dress his arm. Pete initially pulls away when you touch his arm. Only with Nurse Judy's help are you able to slowly remove the dirty bar towel covering his arm. Clean the cut, apply antibiotic cream, and wrap the open wound with gauze. Perfect. At least he let us dress his arm. So dress arm. AJL. Success. All right. We are now, unfortunately, at the 2 o'clock hour. I'm slightly stressed. LAG. Let's see what we got for LAG. Take story card 3. Pete has calmed somewhat. Instead of fighting with the hospital staff, he appears severely depressed. I'm kind of glad I waited now for that psychiatrist. I don't know what happened, he says. My wife was perfect. I had everything, and then she left me. He begins to cry, holding his left side. Appendicitis? I don't feel so good, Doc. His moans turn into racking sobs as his body convulses in agony. You step back just in time, of course, as he vomits up a spray of red. He convulses again, bends over, and vomits 2 more times. A pool of blood, alcohol, and chunks of a sandwich forming at his feet. Take status card 2, drunk and ailing. Take story card 2. This just got brazier. I don't know why I even said that. I'm not gang affiliated at all. It just felt funnier to say. All right. I don't know what I just saw, but I think I might spoil something for myself. All right. Drunk and ailing. Story card 2. It's just discarding story card 1, but it's the same exact questions from story card 1. All right. So I feel like first of all, I definitely have to get this man a blood transfusion. And I also definitely have to get this man a gastroenterologist. We got to figure out what the hell is going on in his stomach, right? But I do want to ask him questions. So I'm going to do, how much did you drink and did you take anything else? This way I understand what is going on. Drink, question mark. And this time it says ZNW. So to the end of the book we go. ZNW, take story card 6. Pete says, I don't know how much I drank. Wait, are you a cop? If you're a cop, I didn't drink anything before I got on my bike. Scout's honor. Cross my heart. Looks. It's been hard the last 6 months since Rachel left me. I hate going back to that crappy little apartment by myself, so I hang out at the bars. What? Oh yeah, how much did I drink? 5 or 6 whiskeys. Wait, did you say you're a cop? I mean 2 or 3. Regulars, not doubles. Did I take anything else? Like drugs? No, I haven't touched cocaine for a couple of years. Not since little Ruby was born. I used to smoke cigars, but who can afford those now that Rachel has... Do you have any liquor around here? You know, something to take off the edge. I'm in a lot of pain. I'd even settle for a beer right now. So he drank a lot, is what I should write. At least I know he didn't take any drugs or anything. All right, I'm glad I at least got the answer to that question, but I definitely want to get, I don't know how much blood he's lost. I'm going to get the blood transfusion going. No, I'm going to get the gastroenterologist first. No, yes. Fuck. Here's why I'm stressing, yeah? Because I don't know what the gastroenterologist... I'm acting like the answers are not right here, literally in front of me. Okay, not procedures... not gynecologist, which I never even... Oh, that probably would have been for the girl who was pregnant that I missed. Not heart health. Where are my doctor friends? Where they at? Where they at? The whole city behind us. Remember that song? What the heck? Oh, I'm just missing one. Specialist. Okay. Yeah, okay. Yeah, okay. I think I'm just stressing about it. Okay, gastroenterologist. Because they enter your gastro system. QFN. He's vomiting blood? That's not good. That's a sign of internal bleeding. You should try an abdominal CT scan, except that's unlikely to reveal soft tissues like ulcers. I'd start with an upper endoscopy to rule out any stomach issues first. Okay, so we're going to do what he suggested. The upper endoscopy. Yeah. So let's order that. And that code is MNL. Take story card 39, which I'm pretty sure is the card that I saw by accident. It is not. Okay, as you show Pete the camera you'll be using for the endoscopy, he backs away from you. You aren't putting it up my butt, he says. You explain to be putting it into his mouth and feeding it into his stomach. You're going to knock me out first, right? If you decide to sedate Pete with midazolam, take story card 40. Otherwise, take story card 41. I don't think we can give him that. Yeah, we can't give him that. Actually, I don't know if that was on here before. Used for conscious. Yeah, no, major breathing problems. We don't need that right now. He cannot be sedated. So we're going to go to story card 41. Pete is clearly uncomfortable as you insert the camera into his mouth. He fusses and can't hold still. He gags again and again, of course. That's a typo. This would have been much easier with a sedative. Instead, you start talking to Pete about movies, cars, and other topics. But when you get to baseball, you got his attention. So you talk sports and are able to distract him until you complete the endoscopy. Take story card 42. Nice. Because I couldn't sedate him. There would have been a major complications. This is the card that I saw, by the way, and you get to see it too. During the upper endoscopy, you discover Pete has a bleeding gastric ulcer, stomach ulcer, likely aggravated by his excessive alcohol use. You stop the bleeding with endoscopic hemostasis using a heater probe you control through the tube. The procedure is successful. Take story card 23. Hey, we're making some good calls here. I still feel like I should give him this blood transfusion though, but we're about to see. There is a wide range of drugs you can give Pete at this time to complete this action. Give Pete as many drugs as you like. List each drug after endoscopy on Pete's patient form. If you have status card 2, drunk and ailing, take status card SC4, drunk and in pain. Otherwise, take story card 36. So I still do have SC2. So I am going to put that away, and we are going to get SC4, drunk and in pain. But there's literally a shit ton of drugs on here that I can give him, right? So let's just start from the top. Amoxicillin. It's a penicillin type. He had no, what's what I'm looking for? Drug allergies. So we could give him amoxicillin. Penicillin type antibiotic used to treat bacterial infections and infected cuts. Will not work on viral infections. He definitely has that cut in his arm, so that could be used for that. Ceftriaxone. Oh, so it's different types. Okay. Used to treat many kinds of bacterial infections. Avoid use if the patient has a penicillin allergy, as there is chance. Well, they're both penicillin, so why didn't that one say that? All right. Clarithromycin. I'm trying my best, y'all. Used to treat bacterial infections, often used in combination with other medicines to treat duodenal ulcers. Is that the same thing as a stomach ulcer? I don't think so. Right? And of course, that's not in here. Are ulcers in here in general? Yes. Duodenal. Upper portion of the small. So no. It's two different ones. Peptic ulcers are open sores on the inside of the lining of the stomach and upper portion of the small intestine. Well, it wasn't a duodenal ulcer, so I don't need that one. Metronidazole. Yo, these drugs are crazy. Used to treat certain bacterial and parasitic infections in the reproductive system, gastrointestinal tract, heart, nervous system. Used with other antibiotics to treat ulcers. Okay, so definitely want to give him the metronidazole, whatever it's called. Okay. Metronidazole. Amphotericin B, a drug used to treat invasive fungal infections because it can cause. Okay, he don't have a fungal infection. Ulcers aren't fungal infections, right? It is an infection, the bacterium as well as long-term use of non-steroidal. Okay. Alcohol is a risk. It's common symptom of stomach pain, while reducing the amount of acid in the stomach. Okay, that's a good note. So I don't need that one. Fluoxetine, whatever. Anti-metabolite, antifungal drug used to treat cryptococcal infections. Treatment for those meningitis. No, I don't need that either. Right? Yeah, no, I think no. Nitrofurantoin. He don't have a UTI. And Prozactinol. I used that recently, so that's also for like a parasite. Yeah, antiparasitic. He don't need that. He don't need that at all. Okay, it says I can use as many as I want, which is a weird way to say that. I feel like there's something else I can be giving him. Oh wait, no, I didn't cut into him, right? Yeah, I was still in his mouth. Pause. 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 That was crazy. I don't know if the cut on his arm is infected. And it wouldn't be I don't know if it's infected or not still. We dressed his arm already. So his arm should be fine. I think I missed one. Pantoprazole. A proton pump inhibitor. Ha! Ha 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 ha! I did miss one. There's another one. It was called pantoprazole, a proton pump inhibitor, PPI, to reduce the amount of acid the stomach produces. Yup. I was staring at this like that. Did I really read everything on here? And I certainly did not. Okay. So now we're moving on. We're still at SC4. And I'm going to put this action back or in the discard pile. And now we are going to move on to the newest hour, which is 4, which this code is NNC. So let's see what the book says. Pete is looking somewhat better than he did 2 hours ago. However, his body still seems stressed and in pain. The downside to his feeling better is that he's becoming quite bothersome to the staff. What's it take to get a drink in this place? He called out to one of the nurses passing his room. So he's being a dick now. All right. Will he let me do the physical now? What does naproxen do again? He's stressed and in pain. And I know that naproxen, IV fluids are the things that I can definitely give him. I remember that for sure. Nope, can't give him naproxen now because that may cause ulcers. And that man already got ulcers. So, don't need that. So that's also out of the question. So the only thing that's safe on here for him right now is IV fluids. Let's get him some IV fluids actually. IV fluids, WVM. That might help. And then we can start talking about the physical. Take story card 15. The added liquids help to stabilize the patient. Now there's some symbol on here. I don't really know what that means, but because of that, I'm going to keep this card here just in case. But success. Now we can give him this physical exam. MKF. As you examine Pete, you notice a bruise and small cut over his eye that has already stopped bleeding and started to scab over. His mouth and nose are clear of any real injury. Apart from the laceration on his arm, he flinches when you touch the left side of his abdomen. His left upper chest is tender as well. There is heavy bruising in both of these areas. Take story card 12. Heavy bruising. That man got fucked up in that bar. Okay, so now updated EMR since we were able to check him out. Face, cuts and bruises, altered cognition, still slurring his words, pain in upper chest, left arm has lacerations, and his abdomen is painful when touched. Do I just want a whole x-ray on his chest? Just his chest, though? That's messed up. Because I want to see what's up with his abdomen, too. Damn it. Pain in upper chest or CT scan on the abdomen. Let's go with the upper chest. Chest x-ray. 4 a.m. Oh, no, yeah, 4. Here, we're here now. NQY. Chest X-ray. M. Nope. N. And that's why, ladies and gentlemen, I'm using a pencil. NQY. Why? Take story card 16. Okay, the radiologist says your patient must have been in a heck of a fight. The bruise in his upper chest is just that, a bruise, thank God. But the 8th rib on his left side near his abdomen is broken. He's probably in incredible pain. The rib will heal on its own in about 6 weeks. We don't prescribe compression wraps anymore because they restrict breathing. There's nothing more you need to do other than to advise your patient to take it easy and maybe give him something for his pain. I can't give him most things for his pain. I'm kind of glad, though, that I skipped the abdomen scan and went straight to the x-ray, because that's almost exactly why his shit hurts, right? Abdomen painful when touched, and it's that left side of the abdomen, right? Where'd the other card go? Where'd the other card go? Am I tripping? Oh, you know what? It wasn't the card. It was... It was in here that I read that. Yeah, left side of his abdomen. Left side of his abdomen. Cool. Okay. All right. Just in pain. Give meds? Question mark? And again, like I said, I don't think there's much I can give him. But now we're going to go to the 6 a.m. hour, y'all. Shit. We've been working on this, man. Only got 3 more actions left. UTP. You're concerned about Pete. Tell me about it. You still aren't confident that he's going to survive the night. You have a feeling that you haven't figured out the entire picture yet. Tell me about it. Here's a guy who crashed his motorcycle, then got up and drove it to a bar. Got into a fight, and was then thrown through a window. I'm going to be okay, right, Doc, he says to you? Rich is going to come back to me, isn't she? She's got to come back to me. Let's go get him that psychiatrist, shall we? I feel like I've been low-key putting it off. Not on purpose, just like there were other things I needed to make sure of first. All right, FKW. Not that his mental's not important, but like... Your patient is clearly drunk, and he's in a lot of pain. He doesn't have a history of mental conditions, although he appears to be extremely depressed. I'd recommend a CT head scan to rule out head injuries, if you hadn't performed one already. Then figure out why he's in so much pain. I'd give him a physical and an x-ray at the very least. Oh, and you could run a drug panel to see if there's anything else in his system. You know what? I did just flat out believe that he didn't take any drugs. I did just flat out believe that, man. That boy hammered too. Okay. So let's do the drug panel first. No, I think I should do the head scan first. Drug panel, head scan. No, we're gonna do the drug panel first. We're getting dangerously close, y'all, to like the point where I'm gonna start losing points for overtime. Drug panel, 6 a.m. UYN. CAPW. The drug panel comes back negative. It appears that while Pete is clearly drunk from alcohol, he's got nothing in his system. Well, damn. He's all clear. All right, head scan it is. Head scan. GCX. The scan shows nothing out of the ordinary. The fuck? 8 a.m. Well, damn, y'all. That's not good. He's just drunk? His head is fine. Like, what? What does it say? MLW. It's the end of your shift. While Pete is looking better than when he first came in, you can't help but thinking you've missed something. Can I leave yet? He says. I gotta find my motorcycle and ride home. He definitely won't be leaving for a few hours yet. Just how much did he had to drink that 8 hours later? He's still slurring his words. CZAL. Your shift is over. If you want, you may take overtime actions. See instructions. Otherwise, it's time to complete your final report, then read the epilogue. We're not done yet. How much did he drink? So there's 3 blood tests. Obviously, I know what the BAC is. That's the blood alcohol. Now we can do. Actually, that's a good. Actually, I do need to check the instructions solely because at this point now there's no like time frame, like how everything else has. So how do I? Okay, for test run after 8, just do the latest one, the 6 to 8 o'clock hour. That's all I needed. That's all I needed. I'm just gonna put this on the ground now. All right, y'all. So again, there's a few blood tests that I can be doing. Obviously, the BAC is check his blood alcohol content. CBC, anemia, infection. No, he's good with fluids now. And a Chem 7. Don't need that either. Okay, pardon me. We're gonna do his blood alcohol. And the blood alcohol. Where's the card? LAY. LAY. His BAC is a 0.15. This nigga is way beyond drunk. He's hammered. What else should I be doing? I feel like I had to give him that blood transfusion. He lost way more blood than I think he did. And that's something I have been putting off for the longest time too, is that blood transfusion. Let me just make sure that it's going to do what I think it's going to do before I... Yeah. Let's get this man a blood transfusion. LWJ. And let's see if that kind of clears him up a little bit. Because even with the IV fluids, he's still not all the way there. Take story card 13. Did I do that already? I did not. 2 units of packed red blood cells help stabilize the patient. Okay, but now what? Is he still drunk? Is he not drunk? We dressed his arm. He's fucking hammered. It never said that he was sober. How is he not sober? He already got IV fluids. I gave him blood. He's just going to be in pain. All right. I think I'm good. I'm going to call it. And we're going to write up a final report. What caused the patient's symptoms? Excessive alcohol abuse. Wait a minute. Actually, we're going to try one more question before we officially wrap this up. Because I got to know. Tell me about Rachel. ASV. Take story card 20. And then we're going to wrap this up. Because I got to know about her. It's clearly his ex-wife. Rachel is my wife, soon to be ex. I don't know what happened. Everything was going great. Everything was going perfect. Job was great. Money was rolling in. And then all of a sudden she says she feels claustrophobic. Can you believe that? Like I was crowding her or something. I gave her everything she wanted, but apparently that wasn't enough. So she left, took the kids, and my life collapsed. All right. Yeah. Okay. Alcohol abuse, ulcers in stomach. which probably ruptured during the fight. Broken ribs and pain in chest. Treatments. So we fixed the ulcer. Provided IV and don't forget the laceration in the arm. And blood for any loss. What else did we give him? And then we gave him 2 drugs we gave him the metronidazole and the pantoprazole. All right, and let me just make sure that he don't have to keep taking these drugs over and over and over again. And if he does, I gotta make sure to tell him that he has to take these drugs. No, that should be good. And the Metro one. Should also be good. Okay. Recommendations. Lay off alcohol. See a psychiatrist. / go to therapy. Consider retaking BP meds. All right, we took 3 actions, 2.5 actions after 8 a.m. So I'll lose, to be fair, I'll say I'll lose 12 points. But let's read this epilogue, man. Let's see what the mother... Here we go. Considering Pete crashed his motorcycle, got in a bar fight, and was thrown through a window, there's a potential for a lot of trouble. He's also so drunk. BAC of 0.24%. He won't answer questions or let you examine him. You could sedate Pete so he's easier to work with, but given how poorly alcohol and sedatives interact, you need a crash cart to keep him alive. Pete's arm has an open wound, so it's a priority. He won't let you suture it before 2 a.m., but you can dress it to give yourself a few extra hours before he becomes affected. He's also lost a lot of blood, so a blood transfusion or IV fluids will prevent an emergency at 4 a.m. Take story card 24. And I did do that. I didn't take story card 24. Wouldn't transfusing blood lower Pete's BAC? At 5'9" and 165 pounds, 75 kilos, Pete has about 5.25 liters or 11 pints of blood. So wouldn't transferring 2 pints or 1 liter of blood reduce his BAC by as much as 20%? Alcohol is absorbed throughout the body, including the muscles and fat, and distributed across the total body water. As a man, Pete is 60% approximately water by weight, meaning he has approximately 100 pounds or 45 kilograms of water, or 96 pints, 45 liters of water. Adding 2 pints or 1 liter is less than a 2% compared to his total weight. That's why neither drinking water nor getting a blood transfusion significantly reduces BAC compared to how fast the body processes alcohol. Ooh, that also tells me that I never actually sutured his arm and he's about to be fucked. At 2 a.m., Pete vomits blood. The gastroenterologist can help identify this as internal bleeding and suggest an endoscopy to determine if it's a stomach issue, which it is. Pete has Helicobacter pylori, which, aggravated by Pete's excessive drinking since his wife left him, has led to an ulcer. A heater probe during the endoscopy would be able to stop the bleeding. You should prescribe at least 2 antibiotics and something to reduce the stomach acid. I only give him 1. Once Pete has thrown up, he's more cooperative. It's worth performing a physical exam to see if there are symptoms you haven't identified yet. If you do, you discover the soreness in his chest and abdomen. An x-ray reveals a broken rib. However, there's not much you can do about this other than provide pain medication and advise him to take it easy. Unfortunately, painkillers and alcohol don't mix together. Even if you chose naproxen, there's Pete's ulcer to consider. Pete's safest bet is to tough it out until he's sober, which will be a while yet. Pete's case is an example of how conditions can mask each other. Certainly, the laceration, broken rib, and ulcer can account for Pete's level of pain. However, he was in both a motorcycle accident and a fist fight. either of which could have caused an internal injury, and they have. When Pete crashed his motorcycle, he landed hard enough to rupture his spleen. Pete needs an emergency splenectomy. You would need to advise the surgeon who has just come on shift about possible complications. Pete's high blood alcohol concentration, blood loss, and allergy to latex. Allergy to latex? Oh, it does say known allergies latex. I thought it said none this whole time. My bad. With this information, the surgery is a success. Nope. There's one last complication. If you sutured Pete's arm, story card 22, he told you that the man he was fighting cut his arm with a broken beer bottle. According to New York law, you must report a wound from a sharp object to law enforcement. See the legal section in research materials. If you do not, it's a Class A misdemeanor and you risk up to a year in prison. In addition to the human body, doctors must know the law as well. I'm going to jail! Plus 40 points if Pete survives the night. I don't even know if he did. Plus 5 points if you perform a physical exam. I did. Plus 5 points if you give Pete a transfusion or IV fluids before 4. And I'm pretty sure I gave him the IV fluids. Nope, I gave him it right after 4. So I don't get points for that. Minus 5 points if you did not dress or suture the arm laceration before 6 a.m. as it has become infected. I did dress it, so I'm good there. Plus or minus 10 tried to sedate Pete. I did not. I'm only at 10 or 5 points, by the way. Plus 10 if the endoscopy is successful and the internal bleeding is stopped. Great, I did. Plus 5 if you prescribe both metronidazole and clarithromycin. These are identified as being effective with ulcers and H. pylori. What was the other one called? The reason why I didn't think I should give him this one, though, I feel like. Where the hell is it? Yeah, because this one said duodenal ulcers, and I took it as he didn't need it, so I don't get those points. Plus 5 if you prescribe pantoprazole to reduce stomach acid. I did, so I do get 5 points for that. Minus 5 if you prescribe any drugs that aren't relevant to his condition. Didn't do that. Plus 5 if you discover Pete's broken rib and advise him to take it easy. I did do that. Minus 5 if you prescribe naproxen for pain. While it is safe to use alongside alcohol, it is not a good combination with an ulcer. I did not. Minus 10 if you prescribe Vicodin. I did not. Minus 5 if you prescribe acetaminophen. I did not. Plus 10 if you identify all 3 complications for splenectomy. Nope. Plus 5 if you recommended help for Pete, such as therapy, 12-step alcohol program, etc. I did say therapy, so 5 points. Plus 10 if you suture the arm laceration to close the wound so it can heal. Nope. Minus 5 points if you notify the police of Pete's BAC for driving while intoxicated. The privacy of blood samples drawn for medical purposes is protected. A warrant is required to access them. You could face fines of up to $50,000 and 1 year in prison. I didn't tell him shit about shit. And minus 5 points for each overtime action. Yeah, I came up negative. I don't even know if he survives the night. I didn't even get a card like that. I don't even know if there's a card like that in here. Damn, at one point he could die. Well, glad that didn't happen. Yeah, there is one in here. He survived the night and is remorseful. Yeah, I don't know how I would have gotten that. There's so much stuff in here. There's 2 cards about his death, by the way. Like 2 separate the man is dead cards. I don't know how I would have figured out the what's it called though. The splenectomy thing. That's so crazy. And I'm glad I was keeping those cards to the side because there's a bunch of stuff here with that emblem on it. Yeah. Well, anyway, y'all, this episode's gone on too long. I don't want to hold you up too much. This game though is a lot of fun. So I would highly recommend getting some friends together, getting some drinks, getting some other recreational activities, I don't know, and playing with your homies. 10 out of 10 recommendation from me. No recommended to me. Find it myself. Anyway, I'm just chatting. That's enough out of me. Take it easy, y'all. This is King Echo, signing off.